gentlemen, and thank you very much for joining us. My name is Grace Nzula. I'm the host of Get It Right with Atara Solutions. I am also a HR consultant with Atara Solutions. Atara Solutions is a HR consulting and training company. We offer HR manager outsource for organizations that don't need a full-time HR. We also offer HR consulting. Please don't sit with your outdated policies. We can help you upgrade them. And if you do not have any, we can help you come up with them. And then we also offer learning and development, and we offer individualized learning, coaching, we offer team building, and we offer training services as well. And of course, we do recruitment and selection. So please do not struggle getting employees on board. So you're tuned in to Get It Right with Atara Solutions. And Get It Right with Atara Solutions is a webinar series that seeks to demystify issues in employment and entrepreneurship. We do this every Tuesday from 8 p.m. and we discuss matters that affect employers and employees. And part of what we are discussing today is part of our mandate in terms of how it affects people in the workplaces. So a well human or a well person is an asset to the organization, and therefore that is part of why we're having this conversation. We have my co-host, we have Catherine Zidandi. Oh, she's disappeared. Okay. She'll come back. We also have Richard. I will allow Richard to introduce himself later, but we have Catherine Zidandi. She's back. Catherine Zidandi is our sign language interpreter. She is an awesome person. She supports us in being inclusive, and she helps us learn sign language as much as we are inclusive and supporting those who have hearing impairment. And Catherine, we appreciate you. We are grateful that you take your time to do this with us. And this is an honor and a privilege, and we do not take it for granted. Thank you, thank you, thank you, Catherine. Now, allow me to give a shout out, and then I will allow Richard to introduce himself and our speakers for this evening. I am very excited today, and because this topic is also close to my heart as well. So before we go to the conversation today, allow me to give a shout out to our partners. Right, we have Nilefront Cottages. Nilefront Cottages is a hotel located in Jinja, Uganda. It's about 2 hours drive from the border. It's such a beautiful place. It's near where River Nile meets Lake Victoria. The views are fantastic. We have Profiles International for those of you who want to become Genos emotional intelligence coaches, or you want to support in psychometric assessments. Profiles International do that for you. We have K Square HR Services. K Square HR Services are our partner down in Rwanda, Kigali. If you're looking for partners around Kigali, if you're looking for HR services in Kigali, Rwanda, then K Square HR Services will be your people. They're into training, and they also offer HR consultancy. We have Steadfast Quality Solutions. Steadfast Quality Solutions is our partner in Uganda, and it is led by my good friend Herbert Zake. Herbert Zake, hi Herbert, how are you? And yes, our speakers, we have Uganda and the entire East Africa and parts of the world here with us. Steadfast Quality Solutions is headed by my good friend Herbert Zake, who is a Gallup strengths coach. He has coached over 500 executives. If you're looking for a coach, then I suggest you get in touch with Herbert Zake. And his organization does board trainings, board evaluations. If you're looking to do an evaluation for your board, if you're looking to conduct trainings for your boards, then Steadfast Quality Solutions will be your people. And then we have AAR Insurance for all your insurance needs. Hotel Sapphire, if you're down in Mombasa and you're looking for a place to host your conference, or you're looking for a place to spend the night, then Hotel Sapphire will be your best bet. We have Tufaha Resort. Tufaha Resort is located in Nanyuki. If you're looking for a place to go for holiday, if you're looking for a place to go for swimming, by there they have a hot swimming pool. And we are heading down to Tufaha on the 12th of April. We have a road trip planned. If you're coming from Nairobi, please join us. I'll show you what we're talking about in a bit. And then if you're looking to become a carpenter or get skills in woodworking, Vanessa Training Institute will be your people. Port Saco, if you're looking for a Saco to join, if you're looking for people who care about people, then Port Saco will be the best bet for you. And then we have Sotet Kinyumbani. Sotet Kinyumbani is a restaurant located in Nanyuki. If you're just around Nanyuki and you're looking for a place to have your lunch, have your dinner, have your breakfast as well, Sotet Kinyumbani is the best place to be. And then I told you about Tufaha. On the 12th of April, Get It Right with Atara Solutions Road Trip Edition is happening at Tufaha Resort from 2 o'clock. It will be an evening of learning, networking, fun, and food. And we are going to be there from 2 p.m. all the way to about 9 o'clock. We have dinner organized for you. We have a conference with wonderful speakers. And this is only going for 4,500 for the conference and dinner. And then if you want transport and accommodation, please contact us for more information. And yes, yes, I thought I had, yeah, we are down in Naivasha for Women in HR convention, which is amazing. And we are having an amazing time today. So allow me to welcome my co-host, Mr. Richard Magoma, to introduce himself. And then it's interesting that the topic for today happens to be on the day he's hosting. So he'll tell us more about the topic and also introduce our speakers. Richard, take it away.
Grace Nzula, the moderator of choice. I hope you are enjoying the Sawela, that is the 6th Women's Convention. And today we have a very interesting topic to discuss around, because it relates to our well-being, and our well-being informs how we perform. It is about cervical cancer. My name is Richard J. Magoma. I am a human resource professional. I am a trainer. I am an events moderator. I also prepare people for interviews. I also train public speaking and other soft skills. But tonight, that is not the issue here. The issue is to discuss issues around cervical cancer, that is the understanding of cervical cancer, the symptoms, the prevention, and the treatment. I will not go deeper because I am not a biologist or a doctor. We have very amazing discussants. We have Dr. Mary Akachalong and Dr. Beatrice Oluoch. They will introduce themselves deeply, because part of the reasons why we come to these particular discussions is to brand ourselves. They'll say where they work and what they do for a living. Take it away, Dr. Mary.
Thank you, Richard. Thank you, Grace. It's nice to be on this platform where we can collaboratively speak about wellness matters, especially matters related to cancer this evening. My name is Mary Achakolong. I am a histopathologist. I am stationed at Saba-Lancet, Kenya, which is here in Upper Hill. I will allow Beatrice to introduce herself also before I get into my presentation.
Good evening. Yeah, my name is Beatrice Oluoch. I'm the corporate and marketing manager at Saba-Lancet, Kenya, which is a diagnostic lab based in Upper Hill. So over to you, Mary.
Thank you. You'll allow me to share my screen. As has already been mentioned, today's topic of discussion is cervical cancer. I have no disclosures, just a few disclaimers. There are a few graphic contents which may be disturbing to some viewers. If you feel that they might be unfit for your consumption, please feel free to skip over, either by just muting what you feel that you don't want to listen to, or just turn away from your screen. There are some images in this presentation that are also borrowed. So who exactly is this presentation for? It's going to be a very brief presentation. This presentation is for women who, or a woman who has the risk of acquiring HPV. We all know that HPV is an oncogenic virus with a very high causal correlation with cervical cancer. So all sexually active women essentially are at risk for acquiring HPV. This is regardless of whether you have one sexual partner or multiple sexual partners. 2, for the woman who has the risk of acquiring a cervical lesion, in the progression of the infection from the point of acquisition, there are a few transformations that happen within a woman's body after she has acquired the infection of HPV. About 99% of cervical cancer is caused by HPV, but only if that infection persists. So what does that mean? About 90% of women can naturally clear this infection within 2 to 3 years of acquisition. And most of that clearance depends on the body's immunity. The rest of the 10% who persist into the different cervical lesions, if you've had an HPV test, you've probably seen categories of lesions like LCL, which is the low-grade squamous intraepithelial lesion, all the way to the high-grade lesions. Once we get to cervical cancer, it's irreversible. It takes about 15 to 20 years, between 10 to 20 years to progress from persistent HPV infection to cancer. And that is the basis for which screening has actually been at the forefront of primary prevention alongside vaccination. So also comorbidities, especially co-infections, name whatever infection you can think of, especially those that are sexually transmitted. Those will also increase the chances because of the co-effect of both viruses. They will increase a lady's chances of getting cervical cancer. The presentation is also for a woman who is living with or has survived cervical cancer. Any woman who wants to learn and relearn what they know or don't know about cervical cancer. And finally, this presentation is for the advocates and supporters of the cause to eliminate cervical cancer. Straight away into what we have today. Today, we are blessed to have vaccination as one of the major primary prevention tools to prevent cervical cancer. There are 2 types of vaccines. One provides protection against HPV 6, 11, and then 16 and 18, while the other only provides protection against 16 and 18. Why that is good is because 16 and 18 are the high-risk HPVs. There are so many subtypes of HPV virus, but 16 and 18 are what have been associated mostly with cervical cancer. The 6 and 11 is notorious for causing anogenital warts. So warts around, whether it's in males or females, warts around the penile area, warts around the anal area, that is your HPV 6 and 11. Today, what is really good is that you can actually test for either the acquisition, the infection, HPV, you can test if you have it, or we can also look at your sample to see the interaction of HPV and its effects on the cells, and you can collect that sample for yourself at home. Allow me to just briefly show you a small video.
Evelyn brush. Instructions for self-sampling at home. Before you begin, read the instructions for use carefully. Thoroughly wash your hands and lay down the Evelyn brush within reach. Remove the Evelyn brush from the packaging. Do not throw the packaging away, as it is necessary for sending the Evelyn brush to the laboratory after usage. Press the sides of the pink cap to remove the pink cap from the Evelyn brush. Ensure that you do not touch the white brush with your hands. Assume a comfortable position such as when you insert a tampon. Spread your labia with one hand, and with the other, insert the Evelyn brush into your vagina until the wings touch your labia. Hold the transparent casing with one hand, and with your other hand, push the pink plunger in the direction of the transparent casing. You will hear and feel a click when the brush is in the right position. Turn the pink plunger 5 rotations in the same direction. After each rotation, you will hear a click. After turning the plunger 5 times, carefully remove the Evelyn brush. Hold the transparent casing with one hand, and with your other hand, pull on the pink plunger until the white brush disappears into the casing. When doing so, do not touch the top part of the Evelyn brush above the wings. Hold the transparent end to ensure the white brush does not extend again. Place the pink cap back on the Evelyn brush. You will hear a click when it is properly in place. Put the Evelyn brush back inside the packaging. Place the packaging containing the Evelyn brush into the plastic bag and seal it. Follow the return instructions.
Thank you. This method for sample collection has actually been proven to be as effective as a clinician-obtained sample. And it's a tool to really empower women to take action for their own health. So about the natural history of HPV, which I have already alluded to, it commonly affects the cervix area. And about 90% of us can clear it and return to a normal state. Or for the ones for whom it persists, it will lead to cervical cancer. You might have noticed that I started my presentation sort of in reverse. So let's get into the statistics. Why do we care? We all know about the statistics. Globally, cervical cancer is the 4th leading cause of death among females. In Kenya, it's the 2nd leading cause of death. This was provided actually very ably by Atara Solutions in the caption to the invitation that was sent out to many of us. But who are these women really? And I've just started with Mama Mboga, but let's walk through this list. These women are our sisters, our friends, our neighbors. They could be in the banking profession, they could be doctors, they could be lawyers, they could be in the HR profession, it could be Mama Mboga. In my case, it was my mom. I lost my mom to stage 4 cervical cancer at a time when we did not have as much technology that we have today. So this should be enough for the woman today to take up her health in her own hands and actually be proactive about screening. So the elimination strategy that has been employed by WHO is the 90-70-90. 90% of girls should be fully vaccinated by HPV with an HPV vaccine by 15 years of age. Another 90% of women identified with cervical disease should receive treatment. And 70% of women who are screened with a high performance test by the age of 35 years, and again by the age of 45 years. All these factors should work together to lead eventually to the elimination of cervical cancer. Allow me to speak briefly about what a high performance HPV test today is. Today we advocate for HPV DNA. The difference between HPV DNA and the differences are many, and the routine cervical pap smear, I'll mention just a few, two. The beauty about HPV DNA is, for instance, if you collected your sample using the Evelyn brush, you can drop the tip into a solution that is specific to preserve that sample. And it allows for the clinical team that is handling that sample to actually store it. And we can go back and keep running a series of tests on it upon either the clinician's request, the clinician who has sent you for the test, or on your request if you want that sample stored. We are living in an era where there is biobanking, where there's a lot of research going on. So those biobanks are actually a resource for a lot of research that is ongoing. The cervical pap smear is a one-time spread on a glass slide. I'm going to read it and it's going to get stored. There is very little that can be done with it after it has been read and your results have been provided to you. So another thing is DNA is highly sensitive, highly specific. Once it's there, it's there. A cervical conventional pap smear is not, it might show me the changes that appropriate an HPV infection. However, it would also be good to just have that sample that can be run and quantified or typed. The beauty about the HPV DNA is, again, it's a molecular test that can type the different strains of HPV that you have. So what do these numbers mean? In order to end cervical cancer, at least 9 out of 10 girls should be vaccinated against HPV. In order to end cervical cancer, at least 7 out of 10 women should be screened by 35 years of age. In order to end cervical cancer, at least 9 out of 10 women identified with cervical disease should be treated. I've already spoken about this disease, LCIL, HCIL, and the lower stages of cervical cancer. Where are we today with this? As regards vaccination coverage, and the figures that are here are mostly representative of Kenya, but I'll also speak about globally. As regards vaccination coverage, by 2022, it was reported that we're at 26% globally. At least 15% of girls aged 15 have received their first dose between the ages of 9 and 15. And another 12 have been fully vaccinated. As regards screening coverage in Kenya, it's 3.2% as of the literature that was reviewed up to at least 2020. This data, however, was heterogeneous across groups, and it reported between 16.4 to less than 40%. The reason for those high figures is really that there was specifications by the group. Otherwise, countrywide, it's about 3.2%. So we can see that globally and locally, we are performing below the targets of the elimination strategies. I put here something about treatment coverage that I just got from AI. I'll read it out. In 2000, the year 2000, cervical cancer was the leading cause of cancer mortality in Kenya, with limited data available on the exact number of deaths, but it was a significant health concern. So we have data today about what the incidence is, how many deaths we are experiencing. About 3,500 women are dying annually in Kenya. But where are the rest of the statistics? And also, it would be good for all of us in this field, whether it's medical, whether it's HR, whichever field it is, what statistics would you like to know about? Maybe that could guide further research, especially if it is actionable. So I'd like us to look at the costs of actually treating cervical cancer. These statistics are accurate up to about 2018. Today, for inflation, a woman who is diagnosed with cervical cancer might spend up to 2 million Kenya shillings, who is funding the cost of her medical treatment. What are the other hidden costs that we might or might not think about? Household income. We are speaking about a time when there is equality today and women are contributing. When we think about women contributing to household income, again, I'm going to challenge us to go back down to all the way from Mama Mboga to the professional in whichever blue collar job that you are sitting at in whichever office you're thinking about. Think about the days lost due to illness. Think about the effect on the economy. When it comes to emotional and psychosocial, last week or two, we were talking about caregiver burnout. So let's walk down the list of potential emotional and psychosocial costs. The effect of the diagnosis on the individual itself takes a toll on the patient. It's very hard to accept that you have cancer, especially if you are going about your life thinking you did not have cancer and it was just maybe a wellness checkup. Lost family time, the stigma and potential loss of support that stigma causes. And then the caregiver burnout, parentlessness for children who have lost their mothers. There are other things we can think about. So how can we collectively create a positive impact? Every woman should be the first advocate for herself. These are the signs. If you have abdominal pain, you have a discharge. If you have a foul smell coming out of you, if something does not feel right with you, don't wait for those symptoms. But if you have them, if you're getting fevers that are associated with these discharges, please
Excuse me,
visit a
Dr.
healthcare
Mary.
professional.
Excuse me.
Okay.
There is somebody who's saying if you can consider raising up the voice. I think the volume of either
Okay.
you should be close to the. Okay. All right. Thank you.
Okay. Platforms like this allow us to create awareness, so we need more advocacy. We need to speak up about cervical cancer. I'm glad to see that there's a lot being spoken of about cervical cancer today, and we do not have to wait for Cervical Cancer Month or Day to speak about it. Be proactive, be an advocate for vaccination, for screening, and for treating. Support, be an encourager, be a treatment buddy. In the space of how we can support financially, I'm glad to see today that medical insurers have stepped up and are supporting some lab tests, which initially was not the case. So I would love to see oncology-friendly, this is just my own terminology, oncology-friendly packages with medical insurance, work policies that allow for a supportive environment and collaboration. Economic empowerment is also another important factor because the treatment for cervical cancer, the journey and all that will require a lot of support economically. Sometimes a woman might need, as part of her psychosocial support, counseling that requires money. We are talking about the cost of treatment only when it comes to surgery, only when it comes to chemotherapy, radiotherapy, but there's a lot that happens in between. If someone becomes anemic, they are going to need blood. If they are dropping into depression, they are going to need to see a psychologist, psychiatrist, or whoever it is. All those are hidden costs that we can come together to reduce. Today, there's a lot of resource for patients and especially also for survivors. I've just put down a list of a few of them, but there is a lot, and the beauty about the world today is that we are in a global atmosphere where you can have these conversations with women in the US, women in the UK, and there is no need for you to feel that you're alone. So thank you. That is it for me. I'll hand it back to Richard and to introduce the next person, the next speaker. Richard, you're muted.
Oh, sorry. Thank you very much, Dr. Mary. At this point in time, let me welcome Dr. Beatrice Oluoch to also give us what she has prepared for us. Beatrice, karibu.
Thank you so much, Richard, for this opportunity. Allow me to share my screen. Can you see my screen?
Yes.
Is it on a slideshow? Can you all see my screen?
We can, but it's on not presentation mode, unless you found a solution.
Is it okay now? Not yet.
No, it's not.
Okay, so you'll allow me to present like that. I think there's a problem with the setup. So my colleague, Dr. Mary Achakalong, has presented on the impact interventions. I'll delve into the path to elimination. So the question is, the path to elimination is through screening and early detection. So where can you do the screening? So that's where the part that I'll delve into by introducing the Saba Lancet Kenya, which is our lab that does the screening. So about us, Saba Lancet Kenya is an ultra-modern and independent pathology laboratory with its ultra-modern main laboratory and headquarters located in Fifth Avenue office suites. So basically, that's the building where Saba Lancet Kenya is, and that is where we are based. We have established fully automated processes for the delivery of accurate and quick results of specialized laboratory services that are accessible throughout the region. As an independent laboratory, we provide exclusive referral services at competitive pricing to hospitals, clinics, laboratories, research institutions, medical NGO, and directly to the public, all treated as high-value clients. In addition to this, we also work with corporate institutions to offer occupational-based screening and corporate wellness with all insurances in our panel. So that's just a brief about who Saba Lancet Kenya is. Yeah. In terms of accreditation, our main laboratory in Upper Hill, where I just projected, is SANAS accredited. That is South African National Accreditation Service, and 14 branches are KENAS accredited. Our mission is to be the leading force in local medical services while offering the highest standards of personalized, preventive, and predictive healthcare in which the patient is at the heart of the organization. Our vision is to empower Africa with the best healthcare services at world-class standards to improve the quality of life of our communities.
Dr.
So
are you able to move the slides? It has remained.
it has
I don't know
remained.
if it's not moving.
Is it moving now?
Try again.
Is it moving?
No, it's not. I think there is a problem.
Okay. So should I stop sharing or?
Because of the technological problem there, I think you
Yes.
can proceed.
Where has it remained in the first slide?
The initial page, the initial slide.
Okay, let me just stop. I don't... Okay, sorry for that. Can you see my screen now?
Yes, I can see SANAS, I can see KENAS.
Okay. But still on slideshow or just it's not on presentation mode?
No, it's not.
Okay, so let me continue. Is it now moving?
Yeah, it is.
Okay, so I've talked about our mission to be the leading force in local medical services while offering the highest standards of personalized, preventive, and predictive healthcare in which the patient...
Just an interruption. Beatrice, if you would stop screen sharing and allow me to share your presentation.
Okay, fine.
You can go on.
I stop sharing.
Yes.
Okay. So I've stopped sharing. So Dr. Mary, you can project. So basically, sorry for that. So I've talked about the mission and vision. Dr. Mary, are you able to? Yeah, okay.
Just let me know which slide to stop at.
Okay, just go till the mission and vision. I've already introduced Sabalancet Kenya and also talked about our mission and vision. Okay, next slide. Thanks for that. Sorry, panic. So Sabalancet Africa was formed by leaders joining forces between Saba Healthcare, which is one of the leading healthcare in France, and also Lancet Laboratories, which is also in South Africa. So Saba Healthcare brings its industrialization processes, know-how, its network of partners, and its medical innovative expertise. While Lancet Laboratories in South Africa go back, Dr. Mary. So Lancet Laboratories South Africa brought in the network of laboratories and also the environmental knowledge and practice. So we had a joint venture between Saba Healthcare and Lancet Laboratories in 2018. And that is what now formed the Saba Lancet Africa. And we are in 14 different African countries. Next slide. So our expertise diagnostics is in 14 different countries. As you can see, we are in Rwanda, Ethiopia, Uganda, Kenya, and it shows also the number of labs in those countries and the patients that we serve. Next slide. Dr. Mary, next slide. So our field of excellence is in clinical and pathology testing, and these are the different fields that we as Saba Lancet Kenya operates in. Pregnancy, fertility, these are different pathology testing fields. So recently we opened a medical center with additional service scope, like X-ray, radiology imaging, X-ray, ultrasound, ECG, that we also do the wellness checks and also doctor's consultation. So we have the medical center in Fifth Gong Avenue, and also in Thika, in four of our sites, Thika, Kakamega, and also Isli. So Fifth Ngong Avenue is where we have now the additional service scope. So basically, this is just a summary of who Saba Lancet Africa is. We overview of the service offerings. We have 4,000 different test portfolios. We do more than 5.2 million tests per year, 22 pathologists in Africa, 160 collection sites, and then we also serve more than 1.7 million patients per year. And we also have 1,900 employees in Sub-Sahara region. And also we have the quality approach in terms of ISO 15189 accredited labs. So, which is also the marker of accreditation and shows the quality testing that we do. So our local team consists of Kenyan pathologists and cytotechnologists who endeavor to offer all our clients top-notch diagnostic services by guaranteeing accurate test results and consultative services. So our expertise is in different fields. I don't want to bother you with all this, but we have different fields: andrology, andrology department, we have the anatomic department. So Saba Lancet Kenya, this is just the footprints, our different footprints. We are in 27 different branches. We have locations in Kenya. And as you can see, it's in different countries. Next slide, Dr. Mary. So I want to delve into this, which is also the topic of today, that what is a health wellness check? It goes along with the topic of today for cervical cancer. A health wellness check is a preventive health check aimed at maintaining and promoting healthy lifestyle. So most health checks are recommended annually. And we as Lancet, we also offer these corporate on-site wellness screenings. And that's the reason why we really push for wellness checks. And the evaluations that we do are body vitals, BMA assessments, assessment of blood sugars, liver and kidney functions, radiology tests, and ECG. And this can be adjusted depending on the company. Unlock your wellness journey with us. At Lancet Kenya, we are passionate in conducting wellness programs for corporate clients, churches, social clubs, schools, and also industries. Like we have the financial institutions, different sectors, technological sectors. So basically, we bring the services closer to you in terms of screening. And the main objective of wellness checks is to drive for early detection of medical conditions and therefore enables timely interventions, optimize the predictability budget for medical expenses and therefore reduce healthcare costs. It reduces employee also turnover, reduce work-related stress and employee burnout. And we also find that it creates a healthier working environment where employees can thrive. And also a healthier workforce increases employee productivity. Yeah. So what does our proposal include? We have pre-designed wellness packages for different corporate organizations and companies, both the male and the female wellness packages. And as I mentioned, we are able to customize according to the needs of the different organizations. Next slide, Mary. And then these are just the samples of the pre-designed wellness packages. We have the essential, male and female, and also comprehensive wellness packages. And as you can see, it has different tests and for comprehensive as additional tests, including the HPV, which Dr. Mary already also stressed on and also showed you how it's safe and it's non-invasive. We also do wellness talks at no extra costs. Once you give us 2 weeks notice, we come in and do the health talks at no cost and also before the screening on site. Next slide.
How many slides do you have?
There are not too many. I'm almost through. Dr. Mary, next.
Okay.
I think a few to go. So we also accept all insurances as listed below. And we with the pre-designed packages, then the different insurances are able to we are able to serve all insurances with the different corporate clients. So I also want to mention that recently, last year, we had a strategic partnership with Old Mutual. So we are able to do the HPV screening, which is non-invasive, with the Old Mutual client. Yes.
Okay, all right.
Yeah.
If you want to be contacted.
So if I want to be contacted, go back, Dr. Mary. Yeah. So if I want to be contacted, the details are here. This is generally the wellness team contacts. My contacts are there, and also my email address. And then,
All right.
Dr. Yes, and then we also have branch lists everywhere. Yeah, thank you so much for that.
All right, thank you. Questions to Mary? Mary?
Present.
Questions to you? I was reading somewhere that there are conditions that make you susceptible to cervical cancer. Probably you can be able to mention them. What really predisposes people to cervical cancer?
Okay, so as I had mentioned before, of course, the pivotal susceptibility is just the exposure to HPV. But there are other conditions that can escalate the progression to cancer, if I can call it that, speed up the progression to cancer. So co-infections like HIV, CMV, any other STDs and STIs, that is number one. Number two, and this is a bit controversial, but multiple sexual partners because essentially what you're doing is cross-infection with various other infections. All those things can predispose someone to a higher risk of acquiring cervical cancer. Another thing is a reduced immunity, really, because remember that we said earlier, 90% of women can clear this infection. However, it is dependent on the state of your immunity. So those are the things that really come to mind.
Okay, thank you. There is a question, Mary, in terms of food, what could be your advice in terms of what you should avoid when you have cervical cancer?
Wow, full disclaimer, I'm not a nutritionist, but eat healthy. That is all that I can say. I am not familiar with any foods that should be excluded from your diet because of cervical cancer. When you eat, make sure you have your appropriate portions of protein, vitamins, and carbs. So if we can open the floor to anyone who has another contribution, but I'm not familiar with any specific foods that are restricted for someone who has cervical cancer.
There is another question, Dr. Mary and Dr. Beatrice, what Indians they are suggesting using the star anise as part of curing cancer, which is the first stages, your recommendation. I don't know what that means. Probably you can get what that person is asking.
Sorry? Could
Star
you
anise.
spell? I'm not familiar with that. We can move to the next question.
Okay.
From what I am gathering, it is like a herb, right? The star anise plant is probably a herb. There are no herbs that are known to treat cancer. There are no herbs that are known, regardless of what the cancer is, there are no herbs that are known to cure or prevent cancer. What these plants do is they can boost our immunity, because we know most drugs anyway are derived from plant products. Also, there are plants that have a positive effect on our bodies. They provide us with antioxidants, they provide us with specific nutrients. In boosting your immunity, then you can be able to fight off HPV. However, please remember that I said once cancer is set in your system, that is an irreversible biochemical change which will require treatment. The treatment options vary: cryotherapy, surgery, chemotherapy, radiation therapy. But I know of no herbs that are capable of curing cancer on their own.
Okay. Does it mean that recurring vaginal infection could escalate to cervical cancer?
Yes, definitely. And why so? Because whenever there's an infection, your cells are really dying off, growing anew, dying off, growing anew. Your inflammatory system is also coming into play to try and fight an infection. The integrity of your the vagina or the cervix might also be breached. So the chances that you're going to keep acquiring infections, and also for those infections to have a conducive environment for them to multiply, becomes higher when you keep having recurrent vaginal or cervical infections.
Thank you, Dr. Mary. I didn't get the nexus between cervical cancer and sexually active groups. That is a question by Solomon Gashewa.
Sexually active groups. HPV, 90% of HPV is transmitted through sexual contact. That is the pivot. So anyone who is sexually active is at high risk for acquiring cervical cancer, regardless of which group you are. regardless of whether you have one sexual partner, regardless of whether you have multiple. The key here is to protect yourself while you are active. I would like to note that someone mentioned palliative care. I didn't mention a lot about palliative care. Palliative care is a very wonderful for patients to embrace, especially. It's very difficult, but it's really a wonderful for patients to embrace, especially when we are coming to terms with end of life. And that is another way in which we can support. At that point in time, a radical acceptance might be what the family or the patient needs. Go on.
Thank you.
No?
Thank you very much. Can women of childbearing age get cervical cancer vaccine?
So that is, I can answer that question in numerous ways. Has this patient had, and this is also up for debate, there are some centers that approve of vaccination for women that have been proven to test negative with HPV DNA, and they've managed to control their exposures. But that would be on a case-by-case basis, and it would be a discussion you should have with your clinician. But yes, some schools of thought are that if I test HPV DNA negative, I can control the other factors in my life. Why should I not get the vaccine? The vaccine currently is approved in Kenya for young girls between the ages of 10 and 14. But yes, outside of that group, the DNA vaccine, the vaccine is approved for, is licensed for vaccination among males and also among women of childbearing age who have tested HPV negative by an HPV DNA test. But that is, we are living in the era of patient-centered care and precision medicine. So that is really a discussion you should have one-on-one with your clinician.
Thank you very much, Dr. Mary. Smoking, does smoking promote or does it make it worse? Does smoking make it worse? Alcohol?
Yes. Smoking can increase your chances of progression to cervical cancer. And mostly it's really about the effects of nicotine. So whatever effect nicotine, and there are several, almost 1,000 substances actually in cigarette smoke. And some of them are known to be oncogenic. What does that mean? They actually do cause or are directly associated with cancer. So it's not only just the nicotine, it's the 700 other substances in the cigarette smoke. So yes, smoking can increase someone's chances of getting cervical cancer. I would like us to make the distinction between acquiring an HPV infection and actually getting cancer. When you have the infection, it does not mean you have cancer, it just means you have the infection. What we, the clinicians, our role is to determine that you have the infection. If it's possible to determine what type of HPV you have, and then how far along the disease are you if you have HPV. Remember, I said it takes about 10 to 20 years for this progression to cervical cancer to happen. And that is why we advocate for screening.
Thank you very much, Dr. Mary. How does this vaccine interact with fertility? That is a question by Marion.
Okay, there's a lot of information and possibly misinformation about infertility, but I know that there are some reported cases of women who have stated that they've had difficulty bearing a child, actually conceiving after they've been vaccinated. But I cannot speak for certain that it is the vaccine that caused it.
Very good. I think.
Sorry, let me just add to that. Whenever there is a situation where there is infertility reported, remember we are vaccinating young girls 10 to 15. It is good to take a full clinical history and understand what the other circumstances around that infertility are, how long she has tried, also include the partner in that healthcare service that you're providing for them. So I don't know of any specific associations between infertility and the HPV vaccine, but some people have claimed that it has affected them.
Thank you very much, Dr. Mary. There is a question by Sarah Karingi, the queen of networking. She's asking, can someone get HPV from services like toilets that have such germs?
Not really. And this is why most viruses require a host. There is no host on a toilet seat. That is an innate environment. The virus is not going to survive there, most likely. So most of the HPV infection is transmitted from human to human. It can be skin contact. The other 10% is skin contact and contact with body fluids. The 90%, as I mentioned, is sexual contact. Do we have any questions for Beatrice?
Yeah, Beatrice, you can add. You can add, Beatrice. You can share where you feel that you need to put an input. Beatrice, you can come on.
Yeah. So I just want to add that it's HPV is sexually transmitted, so we cannot get that on toilet seats. Yeah.
Thank you. There is a question by Ackline. Dr. Mary, also Beatrice, you can chime in. Please enlighten us about if use of tampons causes cervical cancer or it is a myth.
It's a myth. I'll just summarize it that way. Please use your tampons comfortably. The only area that I see could potentially cause the risk is if you are not using the tampon well and it's creating an infection around that area, because there are specific infections that are tampon related. So in the face of an active infection from the tampon, and it's not the tampon that gives you that infection, it's the misuse of the tampon. What do I mean? When you're using your tampon, change it regularly, at least 3 times a day. Wash your hands before you insert it, pretty much like what the video showed you when you're using the Evelyn brush. Wash your hands, maintain hygienic conditions. If you have bruises down there already for whatever reason, sometimes the tampons can also cause injuries. Avoid the tampon and preferably use a sanitary towel during the time of injury of the wall of your vagina, because once there is injury, the chances that you're going to catch an infection are high. So it's really the misuse of the tampon, but it's not the tampon itself that is going to cause the cervical cancer.
Beatrice, comment briefly on genetics. What role does genetics play in cervical cancer?
Yeah. So the role that genetics play in cervical cancer, like now the HPV, the PCR test, the HPV DNA test that Dr. Mary presented on, that's a PCR test. And basically, these are molecular tests. So once you do this test, then and you're negative, then you're safe for the next 3 to 5 years, because the sensitivity is 99.9% sensitive. I like the pap smear, which also looks for the changes. So the HPV DNA test is able to check if at all you have the high-risk strains for the virus, the 16, 18, and also the other 12 strains in terms of genotyping. So probably Dr. Mary, you can also add on that.
I'll respond to the question in another angle. What Beatrice has said is in agreement. I agree with that. So as regards genetics also, we need to know what we mean exactly. Like, are you saying that I might have a specific gene that might predispose me to cervical cancer? I have not heard of any such situation where there are syndromic diseases related to genetic disorders that will cause cervical cancer. Most of this is just viral related in association with any other co-infections. And the other angle would be the molecular testing that Beatrice has mentioned. So I do not know the angle the person asking this question was coming from, but I hope they are answered.
Thank you very much. Beatrice, there's a namesake here who wants to know, is it true that men are carriers of the HPV virus?
Yes, yes, yes. Men are the carriers of the HPV virus. As mentioned, HPV is sexually transmitted. So men are the carriers. But men have their organs, the sexual organs outside. So basically, it might clear on its own while they're showering. But women, we have a hidden cervix. And you'll find that once the HPV is inside of us, then it will just start, things will start cooking inside. And if you don't go for early screening, then you'll find that you are even in, you have the cervical cancer stage 4. So that's why we advocate for early detections through screening. So for men, yeah, Dr. Mary, you can
allow
add.
allow me to just add and say that what has been documented is that there are more men than women globally with HPV. So it is likely, as Beatrice has mentioned, that men are, I wouldn't necessarily say carriers, but most times a female is contracting the infection from a male. I would like to say that this is a bit more nuanced than that, because if you can get HPV from skin to skin contact, then there is no telling who you're going to catch the HPV from. And I'm not saying do not hug your best friend. I'm just saying that I think we are at a time when we need to also think out of the box. So yes, it is true that it has been documented that men are the ones from whom women will commonly acquire the infection. This information has also led a lot to agitation and conflict within couples, because when you tell a lady she's HPV positive, the next thing she's going to do is, you gave it to me. So in as much as the science mentions a few, and I'm not contradicting the science, I'm just asking us to think outside the box.
Thank you very much. Does it spread to other parts of the body once you have it, like the bladder and other soft body tissues? Does it spread?
So it depends on the HPV type. You can have HPV 6 and 11 in your mouth. You can have it in the throat. You can have it on penile organs. You can have it in the anal area. When it comes to 16 and 18, most of it is really on the cervix. What also can spread is if you have the cervical cancer. Cervical cancer, if it has advanced to its late stages, can spread. It can spread directly or it can spread through your blood systems. And by directly, what I mean is, if we go back to the image that I shared, I hope we kept a mental picture of it. If the cervix is affected, it's very possible that the cancer can extend into the vaginal wall. And that actually comprises part of our staging for cervical cancer. How far has it reached? Or it can escape from that area through blood vessels and get into your lymph nodes in the area around the uterus. So the spreading can be of two forms if we are talking about the virus and if we are also talking about the cancer.
Thank you, Beatrice. Some of us are always puzzled when you hear stage 1, stage 2, stage 3. What are the distinctions, Beatrice? When we hear, oh, you should have prevented it when it was a stage 1, stage 2, or better management could have occurred at stage 1. What are these stages? Are they distinctive? Are there features that distinguish them?
Okay, stage 1, stage 4, I think it's that worst stage whereby there's nothing you can do in as much as intervention is done. That is a layman. I would have made that disclaimer that I'm not a doctor, but stage one is whereby now it's early. It's when the cancer has not spread so much. So that's why we really advocate for early screening. So once you come for early screening, then you find that you are still at stage 1 cancer, then that is easily managed by even our oncologists and all that. Yeah. So our pathologist, Dr. Mary, can add.
Yes, Mary, add something to that question.
Yeah.
Okay, thank you, Beatrice and Richard. The stages are definitely distinct. With stage 1, usually the disease is within the cervix alone and it has not spread much. Stage 2, 3, it begins moving into the vaginal wall. Stage 4, it is out of the pelvis and it has gone to the other organs. And as Beatrice has said, stage 4 is really the worst. And stage 1 and 2 are really early stages that for which treatment can actually be curative. The person with stage 4 cancer, it's not that they cannot get treatment. The treatment options are there. It would just be very difficult to manage that cancer depending on how far it has spread. And therefore, the treatment will also have to be very robust and handle the complication of that stage of the cancer. It might combine, as I mentioned earlier, chemo, radiotherapy, and surgery. Please note that it's not an either or, it's really a patient-centered evaluation, whether you're going to get only surgery, cryotherapy, especially for the early lesions, chemotherapy or radiotherapy. So again, it's tailor-made to the patient, but the stages determine what the treatment options and outcomes will be for the patient.
Thank you very much. How often should I hear a lady say that she's going for that test? As a human resource professional, how many times should, and also for us men who do not know, probably our wives are telling us, I'm going for a pap smear. What is a pap smear?
Okay, so I like that. I don't know, Beatrice, should I go first or would you? Let me go first. So a pap smear is a test. If you saw what the Evelyn brush does, it's a test where we take a sample of the cervix. It's not the same thing as a biopsy where a chunk of flesh is removed. It's just the cells. It's like the way I would rub against my finger and remove those cells there. Once I get those cells, since I'm still in the office, let me just show you this is what your glass slide looks like. I will spread the sample on a glass slide. Sorry, I should not have indicated that. I should spread a sample on a glass slide. Once that sample is preserved, I can then look at it under a microscope and then determine, are the cells normal? Is there an infection? The main point of the pap smear test is to screen for cancer or for a lesion. But there's added information that can come with your pap smear test. For instance, can I see the effect of other viruses like herpes simplex virus or cytomegalovirus, CMV? Or can I see other infections like Candida? Sometimes we see those things. So all those are reportable findings. And then once I can tell that there is something abnormal with the cells, I'll make a recommendation. So if there is a TPR that I am not seeing clearly, maybe I've looked at the slide, given it to a colleague, and we are not categorizing it specifically as a high-grade lesion or a low-grade lesion, then we'll recommend that you do the HPV DNA testing if you're at a certain age or have a repeat pap smear. If I'm seeing an LCL, low-grade squamous intraepithelial lesion or a high-grade lesion, then you proceed to have a colposcopy. A colposcopy procedure with a biopsy is really, you go to your clinician, they'll visualize the cervix after dilating, not dilating, but they'll need to visualize your cervix. Take off now a chunk of flesh, which is a biopsy. And now the test for that will be a histology, not a cytology. So the pap smear is a cytology test. We are just looking at cells. With the histology test, we are looking at the interaction of the different layers of the tissue that has been sent. Yeah, I hope that is clear.
Yeah.
Yeah.
Then
Okay. All right. Beatrice.
Okay, to add on that, I just wanted to put in a summary, pap smear looks for the changes in the cervix, while the HPV goes for the virus. Just in layman language, it goes tests for the virus of the HPV. It goes for the DNA of the virus that causes cervical cancers, which is human papilloma virus. So that's why we advocate for, and the cancer guidelines, the cancer guideline states that HPV is the primary screening for cervical cancer. So when you are HPV positive, it does not mean that you have the cancer and you start panicking. It just means that you need to do your annual pap smear to check if at all the HPV inside of you is causing any changes in the cervix. So that's why we advocate for HPV DNA screening, because it's also non-invasive. Yeah.
Thank you very much. Dr. Mary, you mentioned psychosocial issues that surround cervical cancer. You can prepare for that, as I request Jacinta to post our group link so that you can join, so that you can continuously get updated and get other relevant information. Jacinta, you can post the link.
Okay, so I would like to know exactly where to take the discussion for the psychosocial support.
Come again?
Is there a specific question? I would like to know which angle I should take.
Elaborate what it means. You also mentioned treatment body.
Okay, so just imagine you thought you were healthy today and you walked into a clinic or wherever it is you've had I need to go get a wellness check, or I'm just doing it for myself. At that point, allow me to just clarify. You can have a system at the workplace where these wellness checks are annual, but on an individual level, make the effort to have your wellness checks whenever you can. Okay, so back to the psychosocial. So you walk into this place and you're thinking you're going to walk out with results that are normal. And then you're told that you have cervical cancer. That's really the first place where you're walking into reality, the reality that you have cancer. Many times what happens is a patient will be in denial. And sometimes that denial, it's very hard to get out of it. And as we are still trying to battle with that denial, the disease is progressing. So that's one angle. On an individual level, how did you take the news that you have cervical cancer? And what steps are you taking for yourself? Are you getting the clinical reviews that you need? Are you getting the consultations that you need? Do you have the social support around you? When it comes now to the individual with the community, there's a lot of stigma around women with cervical cancer. Number one, cervical cancer is very notorious for causing foul smells. And sometimes people might not want to associate with someone who is smelling amongst them. And apart from that, there's this association in society that someone was promiscuous because they have cervical cancer, they were promiscuous. So inevitably, it might separate your support system from you if these are the associations they are working with as they are trying to take care of you, if you're losing that psychosocial support from them. Sometimes you will need to see a counselor because this disease, it's not just about the cancer itself. What are the effects of this cancer? There's going to be trouble accepting that you cannot go to work. For someone who was 100% functional, if you have to take days off, don't take the days off into isolation. You will get into depression. There are people who have survived cancer. Let them be your pillar for support and examples by which you can live by if you have cervical cancer. Get online, get into communities, discuss these things, discuss what it meant when you told your partner that you had cervical cancer and they left. Sometimes those are the reports that we get as we take care of patients. I told my partner I have cervical cancer and I've never seen them again, and I'm struggling to pay my bills. So it's really just about creating the collaborative networks that you need. But at that moment in time, sometimes the will to get out of yourself and get the support that you need might not be there. Just remember that there are people who have been there and there are people who have gotten out of it.
Thank you. There is a question by Anne. At what age can I take my girl for vaccination, and where can I joined late? Then also you can, I think Beatrice can answer that question. What is the cost of that Evelyn gadget? What is the cost?
Okay, I'll start with the age. In Kenya, the vaccine is approved for girls 10 to 14 years of age. There are programs that rolled out this vaccine in schools. So sometimes you might get a circular from the school asking for your consent, because it should be with parental consent to have your daughter vaccinated. Otherwise, there are hospitals in the private and public sector. I might not necessarily drop lists and names here, but I know that it's also available as a walk-in vaccine within various service providers, both in the public and private sector. So it's available.
Okay. In regards to the cost, I want to start by saying that the cost is cost effective. It's a molecular test, PCR. So the sensitivity, 99.9% sensitive. So the cost is 5,449. We do not just sell the kit alone. The kit, you can pick the kit at any of our branches countrywide in our 27 branches. So once you purchase the kit, then it goes along with the testing bit. So it's a package of 5,450. So we do not just sell the kit alone. So once we cannot sell the kit and yet there is no lab to do the test. So it's only us who do the tests using the Evelyn kit. So once you walk to any of our labs, just say you want to do the HPV DNA screening using the Evelyn brush, then we'll give you the kit and we'll charge you that. And mark you when you're negative, then you're safe for the next 3 to 5 years. So when you just calculate that you'll find that it's even cost effective in terms of daily, it's just a loaf of bread, just a cost of a loaf of bread. So in the long run, it's cost effective. I hope I've answered the question.
Thank you very much, Beatrice, for creating time to come and inform people in regards to cervical cancer. We have really been empowered. Now we can be able to take necessary precautions. We can also be able to understand how to manage it. What is your parting shot?
Okay, so Richard, thank you so much for the opportunity. Before I say my parting shot, I've seen a question here regarding the Lancet Laboratories, Tanzania. Yes, we are one and the same. Saba Lancet, Kenya, Tanzania, Rwanda, all those. So I hope the person who was asking about if it's the same as Lancet Laboratories, Tanzania is answered. Because the East African countries is still managed through Kenyan office. So Tanzania, Rwanda, Uganda, and Kenya. So my parting shot is thank you for the opportunity to present to the Atara Solutions. We as Saba Lancet Kenya, we are honored and we are grateful. So my parting shot is your health is your greatest asset. Do a health wellness check in today for a stronger tomorrow. So don't wait for a time whereby you have that cancer stage 4. That's when now you rush to the hospital. These are sessions that whereby we create awareness so that you also come early and get tested. And you can only do this once you are enlightened and you take a step forward through screening. So don't be left out. Asanteni.
Thank you so much, Beatrice Oluoch. Thank you for your time. Over to you, Dr. Mary. What is your parting shot?
We are living in a time when there is a lot of technology to help us take charge of our health. We are living in a time when you can collect your own sample and bring it yourself to the lab. We are living in a time when you can decide what your treatment options are together with your healthcare provider. Don't wait until you're seeing signs and symptoms. Take charge of your health. Take your sample if you need it. Come and present to the facilities where you need the screening, and let your healthcare providers be part of your journey to good health. Thank you so much, Atara Solutions, Richard, Beatrice, for this time that we have had to be advocates for the elimination of cervical cancer.
Thank you so much, Dr. Mary. Thank you very much, Beatrice. Grace, are you there? But ladies and gentlemen, don't forget that we will be in Nyanyuki next month. Amazing, amazing things will be there for you. And remember, your network creates your network. Your next business, your next job will be in Nyanyuki. That is next month, I think on the 12th. Grace, you can clarify, come.
Yes,
Grace,
it's on the... Can you hear me?
Yes, we can.
Yes, the session is on the 12th of April, and we shall be starting the conference at 2 p.m. But those living in Nairobi shall leave in the morning. It is said to be the event of the year, so please come and get to learn, enjoy, network, have fun, and eat. We normally say a meeting without food could be an email. Ours, we promise. For coffee. Down at Tufaha Resort, Karibuni Sana. And thank you, Dr. Mary and Dr. Beatrice, for the amazing session that you've had today. Thank you very much. Back to you, Richard.
Thank you very much, Grace. Thank you very much, Dr. Mary. Thank you very much, Beatrice. Good night, and the audience, you are amazing for always creating time to come and listen. Thank you very much. Good night.
Good night.
Good night. Bye.
Good night.